Hello, everyone. Michele Crosmer here with Dr. Sean Hashmi, and we are back with plant-based kidney health. How are you doing, Dr. Hashmi?
I'm doing well. How are you, Michele?
I'm doing pretty good. We have actually this topic today. We're breaking into 2 episodes again, and we're talking about lupus and lupus nephritis. And the first episode, we're talking more kind of the medical side of it and how it happens and what's going on. And then we'll dive in more into food and nutrition in the second episode. But can you start off by just simply explaining to us, like, what is lupus? How does it affect our kidneys? And what is lupus nephritis?
Yeah, so, the basic and the simplest way to describe lupus is it's an autoimmune condition, which means your immune system essentially turns on itself. And the thing that's so devastating about lupus when we talk about it is it can affect any organ in the body. It's not just the kidneys. In fact, sometimes it can affect the heart, it can affect the lungs, the liver going on, the brain, the eyes, your blood vessels going on. So there are so many different presentations of lupus. And that's why lupus is one of the most devastating illnesses out there. And for most people who have it, it turns out women are far more predisposed for reasons we don't understand than men are to getting it. Now, in terms of symptoms, of course, any organ that's affected, you're going to have those symptoms. But the early symptoms that a lot of people, especially in my clinical practice, when they come in, they have is very generic. They'll have things like, I feel really, really tired. In fact, fatigue is present in about 80 to 100% of the people going on. So it's a really common symptom. A lot of people also have fevers. Up to 70% of the people will have fevers. Muscle aches are very, very common in about 70% of the people. And joint aches, it could be any type of joints going on, and those are present in as much as 90% of the people. Now, the thing that you got to know about just lupus by itself is that you have a lot of different blood tests. You have tests like anti-nuclear antibodies, or ANA. You have double-stranded DNA, and you have complement. These are the 3 biggest tests that your rheumatologist will check in order to diagnose you with lupus, plus clinical criteria. So they have their methodology going on. But the thing that becomes important to us is that roughly half, now this is why it's so devastating, roughly half of the patients who have lupus, they will go on to develop lupus nephritis at some time during the disease course. And 10% of the patients who have lupus nephritis will end up on dialysis. So when you think about this illness, it is absolutely devastating. And if, God forbid, you have it, it's incredibly important to make sure that you do something about it. Because with lupus nephritis, your risk of death triples. You have a 3 times higher risk of death than you do if you don't have lupus nephritis going on. And when we talk about lupus nephritis, in terms of who has the worst prognosis in terms of having it, it turns out that there's certain ethnic groups. So if you're African American, if you're Hispanic descent, you have a much higher risk. If you're male, remember, women are more likely to get it, but when males get it, it is far more severe. And if you get it at a younger age, meaning in your childhood, your risk of having a worsening disease is far greater than if you get it when you're adult. And then the last thing, which we have several videos and podcasts on this topic, is protein in the urine. So if your proteinuria is greater than 4 grams, then your risk of having worsening disease is substantially higher.
Wow. And so what is it so obviously then it's an autoimmune disease. And so your body is attacking then the kidneys. And so then lupus nephritis of itself, I guess, what in the kidney is it attacking, or what is it causing to happen in the kidneys?
Yeah, so there's this whole inflammatory cascade where your own immune system is attacking the kidneys on the inside. And the way it will manifest is in one of 2 ways. You will see essentially an active sediment in the urine. So what does that mean? It very simply means you may have protein in the urine and or you may have blood in the urine. So you could have both protein and blood in the urine, or you could have just one or the other going on. And this is why when people, if they have those serologies, the ANA, the double-stranded DNA, the complements there, then we have to look at trying to figure out, do they have lupus nephritis going on?
And do you do biopsies?
Yeah.
Is it biopsies or what? I guess what's kind of part of that if someone has lupus and then they're now having blood in their urine or even seeing those bubbles and protein, are there things that you do diagnostically or test-wise differently than someone who has diabetic kidney disease or some other form of kidney disease?
So if somebody has protein in the urine that's greater than 500 milligrams, and they have a diagnosis of lupus already, we biopsy them. And the reason is you have to biopsy them. This is not where you can do a blood test or something else to figure out if they have lupus. You need to understand which one of the 6 types of lupus nephritis you actually have. This is really important because in terms of those types, depending on which one of those 6 types you have, it determines what type of treatment you'll do. So for the folks that are listening, you don't need to know or memorize these, but what you need to understand is when we talk about these 6 types, class 1, which is minimal mesangial, class 2, which is mesangial proliferative, both of those, if you have it, it's fine. You don't need to treat those. You leave those alone. In fact, most of the time when it's class 1, we never even biopsy and find it because the urine is usually bland, meaning it doesn't have blood, it doesn't have protein. So that's when it's class 1. When it gets to like class 3, which is more focal, that's where the treatments start. But the one class that you really want to know is class 4. Class 4 is diffuse, and that is the most common. It also tends to be the most severe form of lupus nephritis. So in terms of all of the classes, we have 1 through 6. 1 and 2 you don't treat. The rest of them you treat. 6 is really too advanced, which means the kidney is pretty much done, and there isn't much we can do about it. So when you're at 4, you're at 5, you're at 3, that's where we really want to go ahead and try and treat you. But in terms of the way to diagnose this, if you have lupus and you're starting to see your urine get really foamy and bubbly, or if your nephrologist or your rheumatologist says, you have protein in the urine, you definitely want to go see a nephrologist. This is not something that a diet is going to fix. This is not something else that you want to wait on because time is of the essence. Autoimmune conditions, if you don't calm them down quickly, they will run havoc throughout your body. And the damage it does, unfortunately, you can't reverse it.
Do you find that people typically, they are diagnosed with lupus and then they get lupus nephritis, or do you find, and this is just, I guess more from personal experience, that people are coming to you because they haven't been feeling good, but blood work is now showing kidney damage. And now they're like, okay, you have this, they're working backwards, right? Like they have the kidney disease and they're working backwards to figure out what's causing it. And then they find a diagnosis of lupus.
Yeah. Lupus is one of those diseases going on that's very near and dear to my heart because my wife has lupus and she's had some of the most devastating complications from lupus as a result of it. So it's an area of research of mine where I've done a lot of looking into, but what's important about lupus that you really want to understand is sometimes I'm the first person to diagnose them having lupus. And so the patient comes in and they say, when you ask them questions, they'll be like, I'm tired and stuff like that. You look at their urine and they have protein in the urine. And maybe their primary care doctor found it because they were complaining of really bubbly urine, or they saw blood in their urine, or, it was discolored and they sent them over to me. So we see proteinuria, hematuria, we biopsy them. And when we biopsy them, we also run all of the serology. So we run a litany of tests to make sure that we can look for the most common things. And what we find is sometimes the serologies haven't even turned positive yet. And yet, lupus is starting in the kidneys. And when you watch these folks 6 months, 12 months later, their ANA is positive, their double-stranded DNA is positive, their complements have now gotten lower. And now they are showing full-blown lupus. But we were actually the first in terms of the kidneys to diagnose it. So in other words, if you're out there, just because you don't have lupus here doesn't mean you can't have lupus. And also, if you have a family history of lupus, it's even more reason not to ignore the signs and symptoms, especially the most common one, which is fatigue and fevers and muscle aches and arthralgias going on and joint aches going on. If you have those, you definitely want to talk to your doctor and explore them going on.
Yeah. Yeah. And I've had that too, that experience with some clients where they've been like, they haven't ruled out lupus nephritis because of certain, blood work and testing that they've done. They're like, we can't definitively say it's this, but we can't rule it out. And so it's this, hard thing.
So remember on that, lupus nephritis, you can definitively diagnose. Lupus, you can't diagnose. And the reason for that is you're getting a tissue sample. And in that tissue sample, when you put it under the microscope and you start to stain it, you will be able to find it. And that's where I have patients who come to me and say, Doc, I don't want a kidney biopsy. But you don't understand. If you don't do the kidney biopsy, I don't know how to treat you. Mm-hmm. And those patients who are sort of their blood levels aren't showing the drop in complements, the double-stranded DNA, the ANA, and they're sort of, do I have lupus or do I not? If for any reason they have protein in the urine, they do need a biopsy, and they need to see that nephrologist, because if we diagnose it early enough, we can slow it down or even stop it. If we don't, that changes things. So remember, there's a lot of things that talk about how is lupus going to progress. And one of the ways that it's going to progress is if we don't do anything about it.
So then that leads me into my next question. What do we do about it? What are the treatment options if it's one of those 3, class 3, 4, or 5 that you treat?
Yeah, so there are so many different options of treatment. The general gist of all of those options is they're trying to suppress the inflammation. They're trying to lower your immune system. So whether you're talking about cyclophosphamide, whether you're talking about mycophenolate mofetil, whether you're talking about just Plaquenil that your rheumatologist is giving you, all of those things, and of course, prednisone is still around, is still part of it. There's some newer medications that are out there that we use as well. But all those choices really depend on what we end up seeing on the biopsy going on. And then we have to look at you and figure out how bad are the kidneys? What is the chance that if we give you this medication, there's going to be stuff going on? Is there other comorbidities going on? But the stuff that's really important to understand is when we treat you, how you respond to that treatment is the biggest prognostic factor there is. So what does that mean? What we're saying there is let's say you're somebody who we go ahead and treat and you have 10 grams of protein in the urine. You have membranous version of it. Okay. If we get your protein in the urine less than 500 milligrams or less than 0.5 grams per day, that is considered complete remission. In other words, we were able to take your disease all the way down to nothing. Proteinuria will never disappear, but if we get it less than 500, and that's 500 according to ALMS trial, ACCESS trial, but there's other trials that say even if you get it less than 1 gram, it's excellent. Even if you get a 50% response, that's considered partial. In most cases going on, that's still considered to be very, very good. So when it comes to looking at things like, well, what's the outcome going to be like? Is this really working or not? It's all dependent on what's happening there with the protein in the urine. And if you don't have a lot of protein in the urine, remember, protein in the urine is the biggest marker for kidneys getting worse. So our goal is lower that number. If we lower it, your risk of getting worse goes down. The other thing about treatment is we also look at your creatinine, your serum or your blood creatinine. If it improves with treatment, that's a very good prognostic sign. Now, if those things don't happen, then we are worried that there's going to be stuff that's going to worsen in the near future going on. So when it comes to individual treatments, it's going to be all dependent on who you are. It's really about what are the side effects of the treatments? How do we make sure? And when you start those treatments, and God forbid you get diagnosed with lupus in the first place, it's incredibly important that every single YouTube video and podcast that we've done about nutrition, that all of those things are going to apply as part of your lifestyle medicine, as part of your management in terms of this. Don't buy into the hype that there's some magical thing out there, because when people are vulnerable, they look for all sorts of things. And, when my wife and I were going through our own journey, we were looking for all sorts of stuff. I read every study I could get my hands on, and any person who had any sort of gimmicky thing, I explored. And what I found was that, it's sad to say, but there's really people, unscrupulous people, who are trying to take advantage of people who are vulnerable. The one thing that I will tell you is really important if you have lupus is to take vitamin D. D as in David. You want to take at least 2,000 international units every single day. And that's regardless of whatever your level is. There was a study that came out in BMJ this year, 2022, and what they showed was that essentially, and this one was a randomized control study, they used vitamin D supplementation at 2,000. They also used fish oil at 1 gram. And what they found was in the group that was taking vitamin D, with or without fish oil, it didn't matter, what they found was that it reduced the incidence, meaning the occurrence of autoimmune conditions, not just lupus, but other ones, by 22%. Now, the study's not perfect. There's a lot of risk. But here's the thing. Vitamin D supplementation is a no-brainer because the risk-benefit ratio, the risk is extremely low. And if there is a benefit, it makes sense. So if you have a family history of autoimmune conditions or anything else like that, taking vitamin D definitely makes sense. And people like, no, I get enough sunlight and all that. Well, first of all, no, you don't. And if you do, be very careful about the skin damage it's doing and the risk of skin cancers and so forth. So really, taking vitamin D makes a whole lot of sense as far as that goes. And if you're somebody who's plant-based, you can take plant-based vitamin D. But still, taking a supplement makes all the sense. Other than vitamin D, there isn't any really specific supplemental recommendations out there. A lot of people feel that turmeric is wonderful, especially if they have a lot of aches and pains going on. I've been using turmeric for years myself. I think turmeric is wonderful. I'm not sure if it's miraculous, but I certainly think it's not going to harm you. And there's very good clinical data in terms of helping with inflammation. So turmeric and a few other things like that are definitely okay to take as long as the quality of the product is good, because you want to make sure that it's a high quality product. As always, I really wish, Costco would sponsor me, but all my stuff comes from Costco. And so anything I end up taking is always Costco.
Yeah. And talking a little bit more about then inflammation, are there certain blood, like inflammatory markers or things that people in their blood work, whether it's maybe that aren't routinely being done, or anything that you would recommend that they have checked if they have lupus nephritis?
Yeah, so, your rheumatologist will always be checking things like ESRs and CRPs, which are inflammatory markers to see how much inflammation there is. So it'll always be the case that that's being done. But while you're thinking about checking markers, just remember, our next episode is all going to be on food. And what you eat matters. And it's the same stuff that we've been talking about time and time and time again. Progress over perfection, and the quality of food, once again. It's plant forward, it's plant focused, it's moving towards a plant-based diet, because when you do that, you're going to find that that is the healthiest diet that you can do in terms of lowering the amount of inflammation you have. Remember, a lot of people have different conditions that require different things that they have to do. But if you have something that's autoimmune, the best thing you can do is do everything you can to make it a low inflammatory diet, to make it more of an alkaline type diet going on. And, the only alkaline diet that I know about is one that's consisting of whole foods, plant-based.
Yep. And I know we're going to go into that. And that was kind of the last thing, I guess, is with, and tying it into the treatment and from more of the medical treatment side. When you guys are treating someone with medication, and is it something where they they see that remission and they have to stay on that medication? Do people get in remission and then they taper off the medication and now it's up to, we want this diet and lifestyle to help sustain this? Or what do you typically see with that?
Yeah, oftentimes what happens is if the disease was pretty severe, then oftentimes they'll be left on things, for example, like Plaquenil, or they may have, in addition to Plaquenil, they may have very low doses of Cellcept. So we'll leave them on lower doses of medications just to make sure that they don't relapse. Remember, the danger in relapse is that next time you have it could be so severe that it will just wipe out the kidneys. So it's one of those things that if you have it once, and if it was severe the first time, we're pretty concerned about it. So a lot of people, for example, are still, from their total body side, they're on Plaquenil for things like they're on it for life. And so most people tolerate Plaquenil very, very well. If there's issues going on, there's other options that are okay as far as that goes. We still don't really understand how Plaquenil works when it comes to things like lupus, but it actually works really well. So the answer is, it sounds crazy. It depends. And a lot of people want to stop the medications altogether. You can, but we go very, very, very slowly. And the danger there is oftentimes when we stop it, if there's a relapse, it's really, really, really difficult to get in control the second time.
Yeah. And I know I'm throwing more questions at you than we planned on, but do people, I guess, how often do you find, like, how frequently do people get these like relapses or flare-ups? And I know some can be, a lot worse than others, but is it generally with lupus nephritis, is it something where if they are responding to a treatment, then it's under controlled well, or do people have a lot of back and forth relapse, flare-ups, acute inflammation going on?
Yeah, if a patient comes to me and they're young, I'm super concerned because I know that the data shows they're more likely to have relapses. If they're men, once again, I'm super concerned because not only are they going to have relapses, they're going to have them frequently and they're going to get worse. And if they're African American or Hispanic, same exact thing. And if they present, even if they're older, they present, but the proteinuria is very high, I'm very concerned. All of those people, you expect to have relapses. So those are people I wouldn't necessarily want to stop medications on. I would watch them very carefully. We would have a joint conversation. But this is one of those things where when patients want to stop the medication, the danger there is if the disease comes back, it's hard for us to control it. I had a patient of mine who was just 20 years old. Her presenting sign the first time was a bleed in the brain. She had a stroke at the age of 20. And by the time, just a couple years later, she was already on dialysis. So this is one of the most devastating disease that destroys families like you wouldn't believe. And it can affect any organ. And, people who've had some of these autoimmune conditions, I can tell you, unless you're in that zone, you can't understand how incredibly painful this stuff is. And we've gotten better in terms of the treatments, but even up until now, do we have a really good, effective treatment for lupus? We do not. Do we have a really good, effective treatment for lupus nephritis? We do not. But we have better treatments than we did a decade ago. And that's the blessing that we have, is we're constantly evolving and getting better and better in terms of the options, but we still have a ways to go.
Yeah. Well, thank you for explaining that. And I guess to kind of just sum things up, because it obviously is, like you said, it's this, devastating autoimmune disease, and it can affect so many organs, but we're specifically talking about the kidneys. But any just general recommendations, advice, anything that you would just want to bring awareness for people around lupus or lupus nephritis in general?
Yeah, I think, the thing you have to know is, first, if you have lupus, you're not alone. There's so many support groups out there. Number two is, don't forget, if you have lupus, you got to focus on sleep. Because if you're not sleeping, you're stressed. If you're stressed, once again, the disease flares and it gets worse. So stress is a killer when it comes to that. Even though your joints hurt, you have to exercise. I can't stress this enough. Things like prednisone that we give you are going to build heart disease, and lupus patients are prone to heart attacks. So you have to fight the clock while you're taking medicines that help one thing, but they're potentially causing another. And this is why what you put in your body is so important. But you got to have that stress minimized in your life. That means whether you're somebody who believes in religion, go for religion. If you believe in meditation, go for meditation. For some, exercise is meditation. But you got to do things that help you to relax and calm down. You have to sleep, you have to move, and you have to eat more plants in your diet and get rid of the red and processed meats as a starting point, and then work your way down from there.
Yep. And I think that's a really good segue. I feel you mentioned you're touching on all the points we're going to talk about in our next episode. We're going more into diet and lifestyle and lupus nephritis. So, thank you for explaining all of this to us. Again, it's always in a way that's a lot more easy to understand for such a complex disease. And if you guys, have questions, our email again is plantbasedkidneyhealth@gmail.com for general questions, recommendations for topics that you guys want us to discuss. That's the place to send it. Or you can, comment on this video, please share, subscribe to our channel, like it, give us any feedback that you have, and we will see you all next week.
Thanks, everyone.